Okay, so here we're going to start talking about infections of the central nervous system by viruses. And the first virus that usually comes to mind when you think about the central nervous system is going to be polio. Now, polio is going to cause poliomyelitis, and poliomyelitis is typically thought of with respect to infants. So we have our infantile paralysis. And the risk of paralysis actually, though, increases with age. So typically, polio infections in children will present with a subacute infection or not progress to full paralysis. However, as somebody ages, if they had not been exposed to polio or had not received the vaccine as a child, and they get polio at a later age, the risk of paralysis is going to increase. Now, with the vaccine present, poliomyelitis is essentially non-existent in modern countries. However, there can be imported cases of the disease, and it is still a major problem in the underdeveloped countries. The virus is an enterovirus, so it's in the enterovirus family, and these viruses have an affinity for the central nervous system. So this is going to be able to cross the blood-brain barrier. Also, it's going to be, unlike other diseases of the central nervous system, this one really goes after the nerves. So it's going to use axons or the perineural sheath of the peripheral nervous system to get into your central nervous system. Motor neurons are also going to be particularly vulnerable, and that has to do also, of course, with that paralysis part of polio. So in general, polio has various levels of neuronal destruction. So polio can cause necrosis. So poliovirus can cause necrosis of neural tissue. And so basically, it's going to destroy cells. And it's going to destroy cells associated with the anterior spinal cord and the brain stem. Then you're going to get an infiltration of your immune cells. And 90% of polio infections are very mild and subclinical because your lymphocytes move in and they're able to kill the virus pretty quickly. Now, the incubation period can be variable. Incubation period can be from 4 to 35 days. And there are 3 types of outcomes for the infection. There is going to be abortive poliomyelitis, and this is typically going to be very short in duration, which you have no signs or symptoms. But you are going to be infected because you do get a febrile illness, flu-like symptoms, chills, fever, that type. There's also non-paralytic poliomyelitis or aseptic meningitis. This is going to be a meningeal type of irritation. You're going to get a meningitis symptoms, stiff neck, back pain, back stiffness also. This again will lead to a complete recovery. And then about 2% of people infected will actually develop some form of paralytic poliomyelitis. So this is going to be a flaccid paralysis, similar to botulism. Remember that they are going to target your motor neurons, so your muscles are not going to be able to contract, so that's why it's flaccid. It's going to temporarily damage neurons, and some neurons can regain function, but the recovery period can be prolonged. And paralysis persisting after this recovery period is going to be determined to be permanent. So even if you have paralytic poliomyelitis in those 2%, you can go back to, it can be recovered. However, if the paralysis extends beyond that 6-month time frame, then a person is said to be paralyzed. Now, polio, of course, has a vaccine, so it has prevention. And there's going to be an inactive and a live attenuated form. Now, the next virus that can directly infect your central nervous system is, of course, rabies. Rabies has this lovely bullet shaped. And rabies is going to look like many other viruses in the respect that it has proteins on its surface. It has glycoprotein spike proteins. It's going to have a nucleocapsid. It's going to have polymerase, so different genes to help it to replicate. Rabies is an acute and fatal viral central nervous system infection. So there is never a chronic rabies infection. It can infect all mammals. And it's going to be transmitted by infected secretions, usually through a bite. The virus is, of course, this bullet shape that's very large. It's going to involve severe neurologic symptoms, and it has a 90% mortality rate. Now, rabies symptoms are going to include relentless excessive motor activity, agitation, hallucinations, overproduction of saliva will occur, and this can lead to an inability to swallow. Bats are thought to be one of the major transmitters of rabies to humans. Now, there are going to be two different forms. We're going to have urban forms, and urban is associated with unimmunized dogs and cats. And then we have our more wild form, and this is going to be in our wild animals. And remember, it can be any wild animal, bats, squirrels, raccoons, etc. Now, unimmunized dogs and cats, there is a vaccine for animals, domesticated animals, and there's a good surveillance for dogs and cats being vaccinated against rabies, and not so much, of course, in the wild animals. Infection to humans is actually incidental. We don't contribute to the transmission of the infection, so basically when it gets into us, it is a dead end for the virus, and the individual will either die from the infection or will recover. Now, the pathogenesis of rabies can depend, and so your pathogenesis is going to depend on where you were bit. So incubation can be from 10 days to as long as a year. And it really depends on the amount of virus you initially was introduced. The amount of tissue infected. And it's going to be, of course, dependent on the host immune response and the distance the virus must travel to reach the CNS. So if you are bit on your face, it's very close to the central nervous system, and the virus can reach it very quickly. If you're bit on your leg, it takes a bit longer for your virus to actually reach the central nervous system. Associated with this is going to be dysfunction of the brain and cranial nerves, double vision, facial palsy, and difficulty in swallowing. You can also have respiratory paralysis, which is going to be the major cause of death. And so the virus is basically going to enter through some bite. It's going to replicate at the site of infection, and then it's going to get into the peripheral nervous system, and it's going to be moving from nerve to nerve through a retrograde transport. The virus will then get to your dorsal root ganglion and travel up the spine to the brain. And then once the virus travels, it gets into the brain, it's going to travel from the brain via nerves to other tissues. And then you're going to get your lungs involved, kidneys involved, salivary glands, etc. The median survival after symptom onset is 4 days. So rabies treatment is going to be prevention. You're going to get a course of injections if you can administer the serum. So you can give passive antibodies, but it has to be administered before the onset of symptoms. And again, once symptoms, you have a mortality rate of 90%. And there is a vaccine available, and usually if you are bitten, you will be started on the vaccine. Now, there are some persistent viral central nervous system infections, and the persistent virus infections are going to be long periods between the actual infection and the actual illness. And so it's going to be very slow in progression. AIDS dementia complex is an example of a persistent virus infection. Now, one thing to keep in mind with AIDS is that HIV will enter the CNS during the acute stage. Of an HIV infection. And what this means is that it's going to just hang out in your central nervous system, and your immune system kind of keeps it in check. But once your immune system, once you become compromised, so once patient progresses to AIDS, then you have neural involvement. So as you progress to AIDS, for example, your immune system loses control of the virus, and it's going to lose control of the virus also in the central nervous system, and then you're going to start to get AIDS dementia. And this can be mild to severe. It just depends on the immune status and how quickly someone progresses to AIDS. Now, there are also other persistent central nervous system infections. We have our polio-like viruses, our enteroviruses, and this is again going to be caused by our echoviruses, enterovirus, Coxsackie viruses, and these are going to be characterized by headaches, confusion, lethargic, and seizures. We also have a rare chronic measles infection, which is called subacute sclerosing panencephalitis. And this is going to occur in children oftentimes years after they've actually had measles. And this is going to be a progressive neurologic disease, but again, very rare.